Lejeune with Lejeune Singleton LLC, Fitness, Health, Nutrition, and Wellness Podcast, Season 4. Today, I would like to introduce clinical counselor and specialists who work with people living with chronic illnesses and pain, Kelsey Harris. Thank you for joining me, Kelsey.
Well, thank you so much for having me on.
Can you give a background on yourself?
Yeah, so I am from Canada. And about 6 years ago, I was diagnosed with a chronic illness. A couple misdiagnoses first, but eventually it was landed on undifferentiated connective tissue disease, or UCTD. And, I obviously had some mental health struggles because of that. And I was also given a diagnosis of fibromyalgia. So I kind of struggled for a while, and then I started to seek all kinds of, as well as Western medicine, alternative health. So naturopath, physio, chiropractor, psychotherapist. So kind of in all that exploration and improvement in my own well-being, including my mental health, I decided that I wanted to help other people in the same way. And for me, counseling was the kind of way to go based on my own background.
Okay, and I know you particularly specialize in acceptance and commitment therapy for people with chronic illness, chronic pains, and chronic conditions. Can you kind of elaborate more on this process?
Yeah, so ACT is what we call it for short, and it's a very active form of therapy, which is why the acronym is the way it is, and has a huge evidence base of being very effective with people with chronic pain and chronic illness. And what it does is it increases our psychological flexibility. So what happens often is that we get very hooked by our thoughts and feelings and sensations about something that we can't actually live our normal lives because we're so hyper-focused on it. And so what we do is we use 6 processes to help people be able to engage more with their lives. So what it typically does is improve well-being, improves quality of life, and it also has the secondary benefit of decreasing any mental health problems, because especially anxiety and depression are so common with chronic illness. And basically what we do is we use these 6 processes called the hexaflex. And the processes are contacting the present moment, which has some overlap with mindfulness. So kind of a meditative quality for the most part, but not necessarily. It's a bit more complex. I can definitely expand if you need me to. Self is context. So this is really like an awareness skill. Diffusion. So we're creating some separation between our thoughts and ourselves. Acceptance, which is really accepting that, life has ups and downs, and we're going to have these sensations, we're going to have these feelings, and sometimes it's okay to have them. Our values, so really connecting with what is important to us, and then committed action, which is values-based living. So are we actually doing things that help us live by our values?
Okay. And how did you come about creating ACT?
So ACT was created by a psychologist named Stephen Hayes back in the 80s, early 90s. And it was introduced to me while I was doing my internship for counseling. So one of my supervisors suggested that I take this course because we had been talking about theoretical orientations and what kind of fit for me, and kind of the more traditional cognitive behavioral was not really up my alley, even though that's what I went to for therapy. But so she suggested I take this course, and I did, and I loved it. And, they explained a lot of the evidence base for what populations it works really well with. So again, that chronic pain, chronic illness. And so I really took it upon myself to really, really learn this. So I bought this textbook, basically memorized the whole thing to the point where my supervisors were asking me questions about how to use it. So because I connected with it and I could see how it helps people, and because there's such a huge body of research supporting it, I was like, this, it's got to be something that'll work. And then I started using it with clients, and I could see how much it was helping people, and it was just kind of sold on it.
Okay. And when you were diagnosed with the autoimmune disease, what was your mindset around that?
Yeah, that's a great question. I was really anxious pretty much all the time. Maybe a little depressed too, kind of like looking back in retrospect, but definitely very anxious. And, my mindset was, oh my God, like my life is never going to be the same. What am I going to do? I had a partner at the time who told me, well, we will never be able to travel together now because you can't travel if you have an autoimmune disease. And that really upset me because I was like, I really love traveling and I didn't want to be put into a box, which I think was kind of a nice motivating factor to seek extra help. But my mindset was really all over the place. I wasn't in a good space mentally. And it takes a lot of work. And I want people to really understand that it's not like I was not in a good place and like the next day I was fine. It was like a few years of really working with different practitioners, including my therapist, to get me to the place where I could really live a good life.
And, that's typically the norm when someone is diagnosed with a chronic illness or any type of, from cancer, the diagnosis goes on, is that fear, or, I'm not going to be able to do the things that I used to do. So at what point, with the therapy, and did you incorporate ACT into your process of becoming more positive and changing your mindset and knowing that, okay, I'm not going to be defined by this disease? At what point, or how did you include these things?
Yeah. So initially, when I saw a therapist, she just did really basic cognitive behavioral therapy with me, which also has a huge evidence base of working with people with chronic pain and illness. So totally makes sense. And a lot of that is just, changing how we respond to thoughts and feelings as well. So it's a lot of overlap, and then doing the actions. So that behavioral activation piece as well. So it was really just step by step. I also, what was recommended to me by my naturopath was to maybe listen to some podcasts that were about, self-improvement, self-development, that kind of thing as well. So I started to do that, and kind of with the combination of traditional therapy and then kind of taking that self-help route as well at the same time. Eventually I just was able to change my mindset. And so I didn't use any ACT processes as they are traditionally viewed back then. But as I learned ACT, I started to include them for myself as well. So I noticed, for example, this morning I was doing a meditation, and typically I sit on a cushion and my foot falls asleep and it's super uncomfortable. And but what I try to do is use the ACT process of acceptance and being like, okay, like I'm going to get really curious about, the feeling, the sensation of my foot falling asleep. And rather than immediately change positions, just allow that and make some space for that to be there, to be part of my experience. And, I can sit through the meditation that way then. And so that's the kind of thing that it continues to help me ongoing.
Okay. And what advice would you give to other people who are suffering from autoimmune disease, chronic illnesses, and pain?
Yeah. First one, I acknowledge it is really hard and it really sucks. And I don't want anybody to think that, it's the change for you is going to happen overnight. If you do want to work on that kind of acceptance and psychological flexibility around your illness, you can live a good life. It just takes a long time. So change is slow, which is something I tell all my clients, because everybody comes into therapy saying, oh, I just want to feel better tomorrow, or, in a couple of weeks, or I want to feel like incrementally better from feeling like a 7 is terrible to I want to be a 2, which is good. And while that's not impossible, it's going to take you a long time. One of my professors once said that it takes about 10 weeks for change to really take effect. So I really want people to understand that it's going to take you a while, and it's a really kind of step-by-step process. So working with the appropriate healthcare professionals is great. If you can't afford to see a therapist, I realize not everybody can, then there is a lot of self-help work in this area as well. So there is a book by Russ Harris. He's an Australian ACT practitioner, and he wrote a book called The Happiness Trap. So if you're looking for a self-help route, I would start there, but it uses all these 6 processes just the same way as I've been explaining them.
Okay. And how do you day by day continue to stay positive, stay encouraged, where you don't go back to that place of when you were first diagnosed? Because I'm
Yeah.
pretty sure it's like days that you may not feel as great as other days.
Absolutely. I do definitely have bad days where I do just want to stay on the couch all day. And sometimes it's okay. There's no one saying that it's not okay to stay on the couch if that's really what's going to make your body feel better. Right. But even on those days, I try to really think about, what can I use in my toolbox to help myself that day? So do I just need to use some acceptance around that sensation that maybe I'm having that's really uncomfortable? Or am I all my thoughts about, what's happening to me this day and what can I do to maybe create some space between them? I meditate every day, and I think that's super helpful to kind of create that real contact with the present moment. And there are meditations that are around these ACT processes as well. So sometimes I'll pop one of those on. But I really just try to take it day by day. And it's not even necessarily about being positive in the traditional sense, but it's having that what Gabor Mate calls genuine positivity.
Mm-hmm.
So just acknowledging your whole experience and, understanding that it's like, there's no point being super positive about something that you can't change, but at the same time, acknowledging what you can effectively do within your situation.
Makes sense. So how did you overcome, if you had any hesitation or fears when it came to your diagnosis, actually, your relationship, your everyday life? Because we know when you're in a relationship and someone tells you, yeah, we can't do this stuff anymore, and it kind of sets you back because now you feel that guilt of, okay, I'm limiting them enjoying their lives. So what steps did you take to continue to say, okay, I'm not going to let that bother me, where I stay in a good headspace of, working on becoming healthier? And how did you become healthier?
Yeah, so great questions. So the relationship wise, so that relationship didn't work out. And I think that's really all for the better because you really need a good support system. And if you don't have one, you have to kind of find one. So for me, and not everybody's going to end a relationship. So I'm not saying to anybody, go do that if they're not supportive. There are other ways around that. In my case, it just wasn't going to work out. So initially that actually made me feel worse because now I had this relationship that I was really into that ended, but eventually over time, I came to see that I was so much better off, and I started to feel so much better because I didn't have that burden. And then I really focused on that self-compassion, self-love. Like, a lot of people are so worried about being alone, and the only person you spend your whole life with is yourself. So if you don't like being alone, like, you have to start to look internally at what is that about? So I think that was so helpful for me, was just to spend all that extra time focusing on, what's good for me. And I still do self-compassion meditations and that as well, because I think that is something that's work that's never ending. And then the second part of your question, what did I do to improve my health? A lot of things, and I'm open to trying things. And I think that's where that's some psychological flexibility. I think it's just, right, like being open to, I don't know if this is going to work, but let's give it a try and find out. So for example, I went to a naturopath and I was kind of skeptical. I was like, naturopath, like a little, like maybe hippy dippy, but I went, I started going, and first couple sessions, okay, kind of cool. She did some acupuncture and stuff, but she gave me this pill, and it was like some kind of natural thing. I don't even know what it was. And she's like, I think this will just help you deal with some of your emotions. I don't know how this worked, but it actually helped. And it might've been just placebo effect, but it's
right. Like a mental.
But it totally worked, and I was kind of sold. And then the other thing that really sold me on her was she was massaging part of my leg, kind of along the vein that goes to your liver.
Mhm.
And she's like, "Oh, you're really angry right now, aren't you?" And I was like, "How did you know?" Because I had this internalized anger, but I wasn't expressing it. She's like, "Because your liver is inflamed and I can feel it here that's inflamed." And I was like, "Oh, this is legit." Yeah. So for me, it was just really like exploring different options for my own health, going to physio, chiropractor. I had really good healthcare benefits at the time. So
Mhm.
if you do have good ones, I would say utilize them. A lot of people don't even realize the benefit that some of these things can have. If you don't have good health benefits, so I don't have very good ones right now, then it's kind of like picking and choosing, okay, what do I think would help me the most right now? So for me, it was the chiropractor. I was like, I think that's what I'm going to stick with at the moment. And then when I have better ones in the future, expand again.
Okay. And what were some of the signs and symptoms that you had that made you go to the hospital or to the doctor to be tested? Because, of course, as you know, as women, we have, signs and symptoms we ignore. And I'm just curious of what were some of yours that other women can look at and say, okay, maybe I should get this checked out.
Yeah. So I only had two real major ones. So chronic pain that's kind of expanded around my body. So it wasn't really anywhere specific. And fatigue. I was just really tired a lot of the time. And I put off going to the doctor for a long time. I was actually flagged by my work at the time. I was working in retail and I was flagged for missing too many days. So then I was like, okay, I guess I should go to the doctor. And my original doctor diagnosed me with gout, which I later found out is impossible in women unless you stop menstruating. So yeah. So if you're menstruating and your doctor gives you a diagnosis of gout, I would definitely question them on that. But yeah, so that was my initial diagnosis. And then, took the medication, but wasn't getting better. So that's why I went back. And I actually just went to an ER. My partner had an injury, so we were in the ER anyway. And so I was just like, hey, I'm just going to ask about this. They ran some blood tests and then gave me a referral to a rheumatologist. Who was able to diagnose me from there. But definitely don't give up either. If you don't think the diagnosis is correct, it may not be, right? Especially if your symptoms don't change when they give you medication.
That definitely makes sense because I am hearing a lot of women that are still having their periods that they're being diagnosed with gout. So definitely helpful for them to look further into. Did you have any type of inflammation or swelling in your body?
No, so very minimal swelling. Occasionally I'll get a swollen joint, but it's not consistent enough. So, and that makes it kind of hard to get a good diagnosis when you don't have something that's like really obviously like external. So I didn't have it. So, which is also interesting that I got a gout diagnosis when like typically your toe would swell, right?
Right. And did you change your diet or, or were you eating healthy prior to being diagnosed? So
Yes.
what type of lifestyle changes did you make besides implementing like the meditation and positive reading and things like that?
Yeah. So diet wise, I've always been a fairly healthy eater, so I didn't have to make huge changes. I noticed that, well, it was mentioned to me that gluten and dairy can be really bad. So initially I cut out dairy. Occasionally I will sneak a piece of cheese. But for the most part, I have dairy-free milk and dairy-free everything. And I wasn't a big dairy drinker anyway, so that was a very easy lifestyle change to make. And then gluten I've really struggled with. So if I eat bread, I notice that I don't feel well. So I try to eat less. But I will admit that that's a very big struggle for me ongoing. And I have tried things like the paleo diet. And I'm very open to trying those things again. I was maybe not in the right headspace to do that. It's difficult to switch so dramatically right away. So, but I definitely just try to eat healthy. Like I eat a lot of fish. I eat very little meat. So fish, seafood, and vegetables, fruit every day. kind of try to have a really balanced diet for the most part. And then the other big lifestyle change for me was exercise. I worked in retail for a long time. And so I was always walking around and carrying boxes and stuff. So I didn't feel like I had to go to the gym, really. I was like, I get my exercise at work, which is true. I mean, I would walk 20,000 steps a day and, get some weightlifting in there. But it took me a long time to be convinced to go to the gym. Just because, again, like that sense that, oh my gosh, like if I work out, I'm going to be in more pain. Right. But the science is actually the opposite of that. If you work out, you'll actually be in less pain, especially if you do strength training. So what I did is I went to my local gym. So this was pre-pandemic, obviously. And I actually just signed up for a personal trainer. They had a deal on. It was like 4 sessions for a reasonable amount of money. And the first personal trainer that I worked with had worked with people with autoimmune disease before. Mm. So he helped me find a really strength-based workout routine that I could do that wouldn't cause me any more harm. He made sure I could do all the exercises properly. And then even when I saw him at the gym after that, he would, if I had a question, he would answer, which was great. But honestly, like exercise is something I do daily now, because if I don't do it, I actually find that I'm in more pain than if I do it. The only time I wouldn't do it is if I was having like a really bad flare. Then it's, typically recommended not to do it anyway. But definitely I would say exercise, number one.
Okay. And as you talked about the, being in the pandemic, how did you continue to stay positive and motivated? Were there any flare-ups or issues for you during that time? And I know we're still in it, but last year was, definitely we were in lockdown.
Mm-hmm. Yeah. So at the beginning of the pandemic, I was definitely more nervous and fearful about getting COVID, of course. I mean, I think most people were, especially at the very beginning. And because I was still working retail part-time at that time, I was like, oh, like it's a little scary to be like handling cash that's being touched by a lot of people. But I didn't have any flare-ups. As soon as we were given the option to stay home, I took that option, and I was really, really careful and just, had my groceries delivered or would pre-order them and just pick them up at the door. And just stayed home as much as possible. And I was able to avoid any COVID contractions or flare or anything like that. And so it didn't really affect me. I mean, I think it affected everybody's mental health to an extent, just the isolation. I had a roommate, but my roommate was had gone back to live with her parents and grandparents at the time. So I was very much alone. So I think in that sense, it was really hard, but as far as my regular symptoms, I didn't notice anything.
Okay, that's good. So how do you provide self-care, self-wellness for yourself?
Yeah, so lots of ways. So again, that self-compassion piece I think is really important. So whether that's just like a reminder to myself or an actual like more formal meditation and mindfulness in general is something that I do. I do things just like take baths. Like if I feel like if I sense that my body needs something, then I'll just do that. So if my body's like, oh, I'm kind of sore, and it's like early, it's like 6 p.m. It's like technically and it's hot out. And it's like not ideal temperature for a bath, but I know a bath will make me feel better. I'll just go do that. And just say really like paying attention to, my wants, my needs, and being that very compassionate self. And, it's okay if you have to set boundaries sometimes with other people. I think that's a big one too, is like, what's okay for other people to say or ask. Like it's not okay for someone to say you can't travel, right? So setting boundaries with people as well has been really good for like my self-care.
Okay. So how can someone contact you for services? Any projects coming up for you?
Yeah, so I'm actually just in the process of setting up a new practice. So I don't have a website or anything like that for that piece yet, but you can follow me on Instagram. It's chronically.living_. I also have a blog it's called Chronically Living. And if you want to try some of these meditations, I actually have a YouTube channel. So it's Kelsey L. Harris Meditations, and they're all based on this acceptance and commitment therapy. So a lot of them are exploring things like acceptance, diffusion, just general, like contacting the present moment, and self as context. So that's a really good place to go if you kind of want to get started on some meditations.
Thank you so much for coming on and sharing, because I learned a lot from you, and I commend your positivity and your, compassion for yourself, because most women, we're very hard on ourselves. We feel, guilty for the smallest things, and you touching on that, and especially going through an autoimmune disease, and you still find that compassion for yourself and taking that time and that self-love for yourself. Thank you for doing that for yourself, and continue. I would like to have you on again when your practice is up and running and talk about that.
Absolutely. Thank you so much for having me. This has been wonderful.
All right.